Doctors, what's the dumbest DIY treatment you've ever seen a patient attempt? I'm an emergency room doctor, and I thought I'd seen everything. Heart attacks, broken bones, people who superglued their fingers together, but nothing prepared me for what walked through my doors last Tuesday night. This guy, maybe 35 years old, comes in holding his left arm like it's about to fall off. He's sweating, pale as a ghost, and clearly in serious pain. His wife is behind him looking absolutely mortified. "Doctor, you gotta help him," she says. "He's been like this for 6 hours and won't tell me what he did." I start examining his arm and immediately notice this weird smell, like barbecue mixed with infection. His forearm is swollen to twice its normal size, bright red and hot to the touch. "Sir, I need you to tell me exactly what happened," I say. "This looks like a serious burn, but I need to know what caused it." He looks at his wife, then back at me, and finally admits the truth. 3 days ago, he'd noticed a small mole on his forearm that seemed darker than usual. Instead of coming to see a doctor like a normal person, he decided to handle it himself. "I watched some YouTube videos," he says, avoiding eye contact. "They said you could burn off moles at home if you knew what you were doing." My heart sank. I asked him what exactly he used to burn it off. He reaches into his pocket and pulls out a small butane torch, the kind people use for creme brulee or lighting cigars. "I sterilized it first with rubbing alcohol," he says, like that makes it better. "Then I held it against the mole for about 10 seconds. The video said that should be enough." I'm staring at this guy in complete disbelief. He used a blowtorch on his own skin because some random person on the internet told him it was safe. The mole was gone, sure, but so was a chunk of healthy tissue the size of a quarter. His wife finally speaks up. "I found him in the garage at 2 in the morning, screaming and running his arm under cold water. He made me promise not to tell anyone what he did. The burn was 3rd degree, down to the muscle. The infection had spread up his arm toward his shoulder. If he'd waited another day, he could have lost the entire limb or died from sepsis. We had to do emergency surgery to remove all the dead tissue. He ended up spending 5 days in the hospital on IV antibiotics. The plastic surgeon had to do 3 separate procedures to repair the damage. The worst part, the original mole was completely benign. I had the pathologist examine the photos his wife had taken before he torched himself. It was just a normal age spot that gets darker sometimes. Completely harmless. This guy nearly killed himself removing something that posed zero threat to his health, all because he trusted a YouTube video over actual medical professionals. During his recovery, I asked him why he didn't just make an appointment with a dermatologist. Health insurance would have covered a simple mole removal for maybe $50. "I thought I could save money," he says, "and I didn't want to look stupid asking about a tiny mole." Instead, his DIY treatment cost him $43,000 in hospital bills, 3 months off work, and permanent nerve damage in 2 fingers, plus a scar that looks like he got mauled by a bear. The really scary part is how many people try stuff like this. I've seen patients use everything from nail files to kitchen knives for minor surgery. They'll mix household chemicals thinking they're making medicine. One woman tried to reset her own broken nose using a hammer and a towel. Social media has convinced people that medical training doesn't matter. That 30 seconds of Googling equals 4 years of medical school plus residency training. This patient recovered fully, but he learned an expensive lesson about trusting random internet advice over professional healthcare. Now he comes in for every tiny bump or bruise, and honestly, I prefer that to finding him half dead from another DIY disaster.